budget battle.
As for the Affordable Care Act, starting tomorrow, Americans can still start signing up for the new health care plans. CBS 2's Dick Brennan sorts it all out tonight.
Since birth, I've been in the hospital mainly. I've been in and out of asthma attacks.
18-year-old Carlos Vasquez is uninsured and has had to borrow asthma medication from friends and family, so he will be signing up for the Affordable Care Act.
Now that I could afford health insurance, I could actually try to stay out of the hospital more because I can afford the medication.
But he will pay a minimum of $150 to $350 per month. Enrollment begins tomorrow, October 1st. Coverage would start January 1st, 2014.
The open enrollment is open until March 31st. And then, actually, if you have a life-changing event throughout the year, you can get insurance.
If you do have insurance from an employer or Medicare, Medicaid, or COBRA, you don't have to sign up. But if you're uninsured, you have to or pay a penalty. $95 or 1% of your income in the first year. That skyrockets in 2016 to $695 or 2.5% of your income. The idea to make sure young, healthy people enroll.
We know that older, sicker people will tend to want to buy insurance, but the plan really only works the more healthy people are involved. So we want to encourage them to be involved.
How much will it cost you to sign up? That depends. Each state is different, and there are different plans.
If you are a legal citizen and you do not have insurance, you're going to go to healthcare.gov. And this is like going to Travelocity to search for a flight. This is not the government actually providing insurance. These are different insurance providers.
And what about Medicare? Well, higher income Medicare beneficiaries, those who earn more than $85,000 per year, will pay slightly more for their prescription drug coverage, or Medicare Part D. This is expected to affect about 5% of beneficiaries. Dick Brennan, CBS 2 News.
Okay, so there is plenty of confusion over costs. They vary depending on your income and what level of coverage you want. So here's an example. The cost for a couple in New Jersey making $50,000 a year would be $395 a month on the Silver plan. That's the second highest level of coverage. But a couple making $100,000 would spend $564 a month if they chose the Silver plan at their income level. So you can choose from 4 levels of coverage. Every state has different options and prices. You'll find information on your state as well as a link to enroll at cbsnewyork.com.
New at 11 now, another vicious beating in